didn't just look at the relationship between ocular graft-versus-host disease and dry eye. That's a relationship that's well understood. But we looked at dry eye heterogeneity. We wanted to understand what dry eye subtypes do these patients present with. And the one we're interested in is something called chronic cicatrizing conjunctivitis, which is just a fancy way of saying that there's fibrosis in the conjunctiva of these patients. And to us, it's meaningful because it's a dry eye subtype that may have worse prognosis. The impetus of this research is part of my bigger program to understand dry eye heterogeneity. I think one of the issues in treating dry eye is that we call everything dry eye. And so I think the way to think about the condition is that it's an umbrella term and there are many subtypes, and those subtypes need to be identified and treated precisely. There's a few things that we found in our research that we are excited about. Number one, that the incidence of cicatrizing conjunctivitis goes up with time. And number two, that the severity of fibrosis can increase over time. We want to continue this line of research in collaboration with oncologists to try to figure out what it means, what are the underlying factors, what's driving progression, how does it relate to systemic factors, and ultimately, how do we improve patient outcomes?